Coronavirus cases and deaths are surging at an alarming rate in the U.S. ahead of the busy holiday season. Health officials are reporting more than 100,000 infections per day for the first time since early October. According to the CDC, the Delta variant makes up most of those cases. Meanwhile, the new Omicron strain is also spreading rapidly. Cases have now been detected in at least 18 states since California reported its first case last week. Some states and cities are taking action to slow the spread of the virus. Nikki Battiste reports from New York City.
Not only is it one of the toughest mandates in the country, New York is now believed to be the first city to require vaccines for all workers. And now children here as young as 5 will have to be vaccinated before any indoor dining or entertainment. The New York mayor today called his mandate requiring all private workers be fully vaccinated, a preemptive strike against the cold weather and the new Omicron variant.
Look, this is how we put health and safety first, by ensuring that there is a vaccine mandate that reaches everyone universally in the private sector.
The mandate will affect 184,000 businesses, but will not apply to people working from home, and there will be no testing alternative. Early data shows that the new Omicron variant produces mild symptoms at worst. In fact, it is believed to be the Delta variant, driving a new wave of cases across the U.S., averaging more than 100,000 a day, with an increase in hospitalizations as well. With much about Omicron still unknown, Dr. Anthony Fauci urged Americans not to get complacent.
We really got to be careful before we make any determinations that it is less severe or really doesn't cause any severe illness comparable to Delta.
The new variant has now been detected in at least 18 states, including Louisiana, where 17 new COVID cases were discovered on a Norwegian cruise line ship that had just returned to port on Sunday. The cruise line said all crew and guests had been required to be fully vaccinated. One of the cases involves a South African crew member who is suspected to have the Omicron variant.
Is there any data yet to show how effective our current vaccines are when it comes to Omicron?
All of the vaccines have shown some degree of cross-protection in terms of virus-neutralizing antibodies, so I would expect the same will be true of Omicron.
Dr. Peter Hotez says vaccination remains the best protection.
If you haven't gotten vaccinated yet, you're playing with fire.
Dr. Hotez says a real concern with Omicron is reinfection, especially for anyone who is unvaccinated. Here in New York City, more than 10% of eligible adults have not gotten a vaccine yet. Elaine?
Nikki Battiste, thank you. Dr. Payal Patel joins me now. She's an infectious diseases physician at the University of Michigan Medical School. Dr. Patel, welcome. So what do you make of Mayor de Blasio's vaccine mandate for all private employers? Could more of these mandates slow the spread of the virus?
Yeah, it's been a year since we had vaccines come out. People have had the chance to get vaccines on their own. And we saw a first uptick with people who voluntarily got these vaccines. And then a number of employers did mandate the vaccine. And you've seen, again, an uptick. And New York is actually doing quite well. After they mandated vaccines in some of those public institutions, they've had up to 94% get vaccinated. So I think this makes sense as a next step to really protect New Yorkers, and hopefully it could be a trend throughout the nation.
So at least 18 states have now reported Omicron cases, but it's interesting, in South Africa, where the variant was first detected, scientists say they have yet to see an increase in hospitalizations or deaths. Is that good news?
I unfortunately don't think we can think anything of it yet. It's too early. Some of these studies are still ongoing in understanding how Delta variant works. So I think it's going to be a little bit of time, and it's too early to tell. What I would say is, for us here in America, we are having, huge upticks in infection with the variant that we have that's most common here, which is Delta. So we were already in a bad place, and it's worrisome that we might have something else coming. So I would take that all with a grain of salt.
Yeah, we still don't know how effective our current vaccines are against Omicron, but some experts believe they will offer some protection. Can you explain that?
Yeah, I agree. That the good news has been with all the variants that we've already seen, including Delta, the vaccines have actually held up quite well. They were intended, again, remember, to prevent hospitalization and death. And for those of us that have been vaccinated, if we have gotten reinfected, most of us have either had an asymptomatic infection, which means you don't have any symptoms at all, or maybe some mild sniffles. So I think the vaccines have done what they were intended to do, and our hope is that they will continue to do that with any new variants as well.
Well, the Delta variant still makes up 99% of circulating U.S. cases, and more than 75% of U.S. counties have high transmission. Remind us, why is Delta such a major threat?
Yeah, that's the thing. We're still trying to understand how Delta works, and now we have a new variant to deal with. The good news is, again, the vaccines really seem to help with that protection. I know that in our hospitals here in Michigan, most of the folks that we're seeing in the hospital are unvaccinated folks. So again, remembering that we know what works, and that is the vaccine, and that's going to be the thing that can really protect you.
Well, given that Delta makes up most of the country's cases, how likely could we see Omicron become the dominant variant? What happens when we see two variants like this competing?
That's a good question. I remember when we chatted early on when Delta first came out and how quickly Delta really became the main variant in the United States. I think that is something that we'll be keeping an eye on. And as we understand more about what that means for the new variant, we'll understand what that means for the public. But I would say, again, we're already at a point where we're keeping our guards up. In our hospitals, we're often running out of the meds that we use for these patients, as well as beds. So we're already in dire straits in many states. So I would say it is concerning, and going into the winter, that viewers should continue to do the things that I know that we're all feeling fatigued from: masking in public places, and really trying to protect yourself from having to go into the hospital if you can.
All right, Dr. Payal Patel, thanks as always for sharing your expertise with us. We appreciate it.
Thank you.